Any health-related information on the following show provides general information only. Content presented on any show, by any host, or by any guest should not be substituted for a doctor's advice. Always consult your physician before you begin any new diet, exercise, or training program. And thank you for listening to the Whole Care Network.
Welcome to Healing Ties on the Whole Care Network. On Healing Ties, we're creating a life to love after caregiving ends by sharing stories and resources and being with awesome people like you. Now that caregiving has ended, let the Healing Ties begin. Here's your host, Chris McClellan, the Bow Tie Guy.
Well, greetings everyone. It is Chris McClellan, the Bow Tie Guy, for another episode of Healing Ties. Thanks for joining me today. And actually, we are having our second podcast, our follow-up podcast with Dr. David Baer, who is out in Pueblo, Colorado, and we're celebrating the Love Senior Day with Care Match and our good friend, Carol Chirito. So, Dr. Baer, welcome back. It's great to have you back on the show.
Great to be back. Thank you for having me.
Yeah, in our last podcast, we really get such important and understandable information about sedation and IV therapy, and I know you put me at ease about going to the dentist for the next time, but I think another area that I'd like to chat with you about today is we touched it just a little bit in our last podcast, wisdom teeth. I had my wisdom teeth out about 10 years ago. Implants. I hear a lot about implants, good things, bad things, but I think the person to really talk to about these important decisions is you. So could you let our listeners, what is your philosophy, I guess, on implants and how they work and the procedure, if I could be so bold and ask such a broad question?
Sure. Yeah, no, dental implants are a phenomenal, they're a whole different animal. There's been implants, weird ones throughout this, literally 100 years they've done weird ones, but in the 80s, they really found a very good system, which is basically a root replacement implant. So it literally is replacing a root of a tooth. And a dental implant, these sophisticated screws, if you will, are placed in the jawbone, replacing the roots to the teeth. Now they can be there replacing a single tooth, and you could put a single crown on each one, or you can often replace, just like bridges, you can do implants that will replace a few teeth, where you do maybe 2 implants, and it might replace 3, 4, or 5 teeth spanning a bridge, just like a conventional bridge, which used to be attached to actual tooth roots, but here it's attached to implants, so it's an implant bridge. And then we also have different solutions for people where perhaps maybe people have already lost all their teeth, but we can still actually use implants to help them improve their dentures. We can put in at least a couple implants per arch, their upper or lower arch. Okay. We can put those implants in, and it helps that denture stay put. I've noticed patients throughout, forever have complained that the lower denture predominantly just does not sit still. And that floor of your mouth and your tongue moves, and it lifts up the denture, which many people are wearing. And so having a couple of implants in there can really help that denture stay put, and actually can improve the statistics, and the studies have shown biting forces have just tremendously increased with these implants. So people can not just chew better because the denture stays in place, but they can chew stronger, and they reactivate these muscles in our face which atrophy, and so it's a little bit more, they might gain a little bit more of a youthful appearance, literally, over time, wearing a denture that is implant born, because they've lost a lot of muscle tissue and atrophy by not really chewing when they're using dentures without implants. And then, of course, there's another final solution, which You can actually replace the teeth, and the denture is, before I was saying these implants can snap into the denture, like a Levi button, if you will.
Okay.
And so they can kind of snap the denture in and out. And those are removable, which are great. People can still take them in and out and clean them and take care of them. And then the final frontier, which is currently, and I'm sure there will be more things in the future, who knows, but currently the final one is where people have a fixed denture, if you will. And it is these fixed prosthetics where we have the implants which bear the entire prosthesis, or it's something like a denture. But instead of having a denture which kind of goes over our jawline like a saddle would, here these are literally screw retained, and the person never has to take them out again. They do have to clean. Yeah, they do have to clean in between them, in between where their gums and this denture sit, this prosthesis. It's not really a denture, but where it sits, they do need to take care of that. But literally, they just need to come in once a year, and the dentist can actually unscrew the entire prosthesis, clean it up, and screw it back in and send you on your way. And it's a good thing to do either way, just for, just like going to any physician, you should go for your checkup, and the dentist will usually do a cancer screen, make sure, hey, there's no bumps or things that might be suspicious. So it's a good time to get that checked out, as well as make sure everything is clean and doing well and progressing as it is. So there's wonderful options for people. And like, things, as we mentioned in our last podcast, the mouth is a rough environment. It beats up on itself. And luckily, it does heal in an unrivaled capacity with the rest of the body. It really does have better healing, but not the teeth, but the bone in the jaw. They have a much better chance of healing than pretty much anywhere else in the body. So replacing teeth, there is a great thing now. We have this very predictable system in place. And yes, implants can fail. We don't want to tell people that, don't take care of it anymore. It doesn't matter. Now you've got an implant. It's permanent. It's perfect. And you never have to do anything for it. It still requires you to maintain it, to swish and brush and clean and keep things as clean as you can. We can get diseases around the implants called peri-implantitis. People have probably heard of periodontitis.
Yes.
This is just the same thing around an implant instead of around a tooth. That really is the mainstay for implants. Is the problem there is peri-implantitis. However, at least implants cannot get decay. So half of the problem that we have with teeth, implants are immune to. Titanium doesn't get decay, so we at least have that.
Goodness.
But when I say they do fail, they don't fail a lot. Although it's they're in the high 90s percentile. We found ours run in the 98, 99 percentile. Now, it's never fun. I mean, admittedly, I placed plenty of implants, and occasionally one just doesn't like it, and it's kind of interesting. Smoking is a risk. There's certain health factors that are risks.
Sure.
But you do enough of something, and they might not work. Now, that being said, I've found studies have shown they have a lot higher success rate when we replace them. And if the person is not doing any harm, if they're not chewing rocks and opening their, implants with beer bottles, I'm very prone to just replace them and just do it, because they generally fail. And when I say fail, it means they get loose and the whole thing starts to want to wiggle out. And we literally just can easily remove the implant. And usually, sometimes we can replace it that day or a couple months later. But we can replace those implants usually pretty well, and actually going from a 98% success rate, then it turns into closer to 99% success rate. And so it stinks if you're that 1%, that first time if something fails, but try to be optimistic, try to be patient. Implants are a bit of a process. There are the options. We can do things in one day. It does get a little bit pricey, and many will say it's worth it, though. Many people who have it done will say it's worth it. But other things, we might want to wait. We may want to say we're going to remove the tooth, and which is fine for some people because they say, hey, let's not gouge my pocketbook all in one day. So we do the extraction and maybe a graft, and then they come back and we do the implant. And then a few months later, they may get the crown. And all those steps, it's like spreading out the cost as it is. It's almost like having a payment plan. But either way, they're just a wonderful solution to helping people getting back to chewing. And like I mentioned before, getting away from that atrophying of the jaw so they can actually eat, carrots or broccoli or things that, if you're missing teeth or if they're painful, then we're sometimes at a loss. And our diet and our nutrients are generally, we've found without implants, a lot of people just really aren't getting the nutrients they ought to be. And so
the positive impact
like you
is
said,
just the charts.
Yeah. Yep. Overall health, as you can imagine, starting to eat more broccoli compared to just eating nothing but very soft and processed foods and things like that, it takes its toll on our bodies and our minds and honestly on our outlook. Sometimes it just frustrates you and wears you out, and you just wish you could feel younger again. And a lot of times the implants will help bring that liveliness back to your life where you're thinking, hey, I'm chewing again, and having a positive outlook again instead of being kind of frustrated, because we all get caught behind the 8 ball sometimes. And,
you can go back and eat some of your
solutions.
You can eat some of your favorite foods that you haven't had in a while, and what a psychological boost that is.
Absolutely.
But I do have to say one thing, Doc. You've left me with on podcasts, we don't usually get a whole lot of visions, but you've left me with a vision here today. And that is, you use the analogy of somebody opening up a beer can with their implant. So I'm
It has happened.
I'm sure it has. I'm sure you have some stories too. But we'll respect all your patience. But with goodness, with the great work that you're doing and putting people at ease, because these are big decisions. But I guess the one question that I'd like to ask before we close this podcast is how do you determine, or how do people determine what is the best route for them to go? Because if I understood you correctly, it seems like there was 2 or 3 different types of options that people might be able to select from.
Yeah, if somebody is already having dentures or needing all their teeth removed, the middle option where we put implants in, but they snap in, is very cost effective. And it costs much less than having that fixed solution I mentioned, which is a wonderful solution. But the fixed solution, there's wonderful dental surgeons and oral surgeons and periodontists throughout this country, and they're doing that solution. But it is going to cost you anywhere from $20,000 to $30-something thousand per arch where it's fixed. And that's great. It's wonderful. And some people are taking out loans kind of like they would buying a Honda. And they're investing in themselves. And then others where it's a lot more cost effective, where if you already have the dentures can sometimes be retrofitted to where 2 implants, or depending on how many you get, 2, 4, 2, 3, 4 per arch, you can actually get your denture retrofitted to snap into those implants. Quite possibly, not always. There is that option. So then it just becomes a cost of what's the implant surgery going to cost. And then removing teeth or single teeth with a crown on top of that is another option, but that's usually for when people are just going to be missing 1 to 3 teeth or 1 to 5, for these implant or implant bridges. But either way, all the options are available, and getting the most teeth per, stabilized for the fewest implants. Obviously, those overdentures that I mentioned that click into or snap into the implants.
Sure.
Those might be the most teeth per implant, bang for your buck, if you will.
Okay.
And they do work wonderful. I mean, I've had people that just they think they want 3, 4, 5, 6. And I've had some do 3, and they have a hard time taking it out at night. They snap in so firmly. And so, if when all said and done, we try to do as few as possible, and we don't want to break the bank. And the nice thing is we can generally come back and we can add more implants later. So if somebody says, you know what, I've been saving up, and the 2 is not good enough, let's go 3. Let's add another. Let's add 4. And that's how it goes. And we've generally worked our way through things like that with people and tried to find where they are happy. And I guess that would be consulting with your dental practitioner and asking your doc, what do you think? And kind of telling them what you want and having the dentist help you find what you need. And come together, and hopefully you can find exactly what's fitting in your budget and what's fitting for your goals and what you want to achieve in your dental health world.
Yeah, I think it's so parallel to all healthcare is that we have to be comfortable in asking all the important questions so that whatever we choose, we know that we've got as much information as possible to make the correct decision, because it's not always the Cadillac that's the best, but when you can talk to somebody like yourself, who's not only a professional, but can explain it in layman's terms, then I think you have a win-win.
That's good. That's what we all hope for, and if someone came to see me too, and I always say, there's friends, there's great dentists all over this country, and I'm happy to tell people. Talk to a couple of us. It won't hurt. It's not going to do any harm to talk to multiple people. It gives us perspective. It gives the patient perspective. And I think it's a wonderful opportunity for people to really kind of hear different outlooks, and then they themselves might come to a better conclusion. So there's absolutely nothing wrong. We totally encourage that for everybody to seek out what they want and what they think is going to be best for them. Mm-hmm. And the dentist, we hope, will find the best treatment and come together. And that's what we're all looking for. Like you said, we just all need to find what works for us.
I know you'll appreciate this comment as for another doctor that I had on a podcast a while back, but he had said that his best patients are the ones that ask him the most questions.
Yeah, that's about right. And we want to keep it safe, keep it boring, and make it what you want.
Make it what you want.
Make it the best thing for you.
Well, goodness, we've just got a couple of more minutes left. Doc, I've just thoroughly enjoyed this. I hope we could do some more of these. It's just terrifically informative, and you're great to talk to. I don't have to ask a whole lot of questions because you anticipate what I'm going to ask, and that's a good thing. So, but let our listeners know how they can find you on the internet, all your contact information, and I would love to invite you to do a few more podcasts with us here on the Whole Care Network when your time permits.
That sounds fantastic. Thank you. Yeah, if they want to give us a call, we're at 719-696-9009. Again, that's 719-696-9009. And the surgery center is called the Pueblo Dental Surgery Center. And we're in the south end of Pueblo. Our address is 2041 Pepper Lane, and that's in Pueblo, Colorado. Again, 2041 Pepper Lane, just like salt and pepper. It's a wonderful, beautiful facility. We built it so people will enjoy it and feel very relaxed and comfortable there.
Well, I hope on my first visit to Pueblo, I certainly want to meet you in person and come out and see your facility. But I certainly appreciate you taking the time, and I just know firsthand now after talking to you that the great work that you're doing, you're certainly someone who's creating healing ties all around us. I can't thank you enough for joining me today.
Thank you. Thank you for your time.
Okay, goodness, a lot of great information about our oral health that we often, I'm being a little self-revealing here, that I don't take as good care of my oral health as I probably should. Maybe that's because of 3 years of braces down the road, but we'll talk about that on another podcast. But as you know, I'm Chris McClellan, the bow tie guy. I'm creating a life to love after caregiving ends through radio, writing, travel advocacy, and being with awesome people like Dr. David Baer. Healing Ties is a part of the Whole Care Network. Check us out online at thewholecarenetwork.com. We'll see you for another episode of Healing Ties real soon. Bye-bye.
Thank you.